BlessingCeo don't cast
all the necessary, documents here, their hospitals, but I don't think it is wise for me to publish my report on social media. People can personally scrutinize, people that are reputable, people that want to check their hospitals, to do their necessary investigation. I don't think cancer is something anybody wants to lie about.
Yeah, but if you say that people don't have a right to your privacy of your report, I think they are very entitled to, because they are donating to a cause. They must know that this cause does exist.
Yes, like from the initial stage, I cried out on social media, not because I wanted money. I was genuinely concerned and worried.
But you also said it was stage 4.
Yeah, that was what I was told.
Who were you told that?
That was what I was told.
That's what
my
the doctor
report.
told you?
Yes, so that was like when I said stage 4. You
How
could
did
see
they know that it was stage 4? How did your doctor know that it was stage 4?
It's from the report. When they do the biopsy. I don't know. I'm not a medical.
Okay, let me ask a doctor in the house. This is why I brought her in. Okay. So from what Blessing is saying, she discovered when the first time she went to the doctor, as she said, it was a lump, and they told her it was non-cancerous, right?
Yes.
She goes back there 6, 7, 8 months later,
yeah.
And that's how she discovered that it was cancer stage 4. So for you, as a doctor, what are the procedures what would you like to ask her concerning how she got from that level to the stage 4 level?
First of all, I'm very interested to know what type of doctor you saw, because there's a lot of disparity that I don't expect in medical personnel.
Okay, what are disparities?
So first of all, when a patient comes to me and complains of a lump, I will not do a biopsy first. I will first do an imaging. So I'll tell you to either do an ultrasound scan. If you're less than 40, you're 35, 40. Then if you're above 40, you can do a mammogram before we get to the biopsy. And if you then do a biopsy, depending on what we're suspecting based on your history, you either do a fine needle aspiration cytology or a core biopsy, right? And after that, even if, because what you're describing kind of sort of sounds like you did a fine needle aspiration cytology, right? Even at that, no doctor on the surface of this earth that is qualified would allow a patient to move around with a lump in their breast for 6 months, because you don't know. Even if you do a fine needle aspiration cytology, they can be false negative. There's a very high chance of it being false. So you can never tell unless you remove the lump and you do a proper biopsy of the lump.
So I find it
very interesting so I'm interested to know the type of doctor you saw. What type of doctor?
It's an oncologist.
Okay, so now fantastic. So I work in a teaching hospital. We don't send patients to an oncologist unless you have a core biopsy result.
But you haven't had
because usually you start with a general surgeon. General surgeon will establish the fact that it is cancerous. And oncologist is not the first person. Based on the fact that you even said, the person said it is not cancerous, no doctor will send you. That's why I'm interested to know the doctor. No doctor will send you to an oncologist with a non-malignant result.
Like I said, you go into the hospital. I noticed a lump on my boobs.
Was it Lagos or Enugu? Because
I was in Enugu.
Okay.
So I went into the hospital.
Was it a teaching hospital?
No, it wasn't a teaching hospital. It was a private hospital.
Okay, and it has an oncologist. That private hospital has an oncologist.
Let me explain.
Okay.
So walking into the hospital, you go to a normal doctor. I don't even know what they're called, but you went to a doctor. He examined. He found the lumps.
Okay.
That was when he said, "Let's do a biopsy." I don't know what a biopsy is.
Without an imaging?
No.
That's very strange.
No imaging, because
is that possible?
It's not possible. It's not possible, because biopsy is very invasive. Nobody will grab your breast and just do a biopsy without an imaging.
There was no imaging.
Was it the left breast or the right breast?
The left breast.
Okay.
So they didn't do an imaging. They just said go for a biopsy. It was when I went for the biopsy. It took about
Was it painful?
What was the biopsy process like?
Yes, what was the process like?
Explain to us.
I think they gave me a little, I don't know if it's anesthesia to like numb the pain a little bit. Then an incision close to the nipple.
And what came out?
That's not the procedure. We don't do an incision.
I don't know what, but something went into my.
Okay, so
my results are
here.
here.
You saying that's false? It's not possible to.
No, yeah, it's not. It's not sounding like a fine needle. It's not sounding like a core biopsy. It's not sounding like a fine needle. We use a needle. It's a needle.
This one is like how do I put it? I call it a machine. I don't know the right terms.
Oh, listen, you're mixing things up. We don't use machine for biopsy as well. That's an invasive procedure. We use a needle.
Something went into my boobs. They brought out some. I think they said
out of your boobs. Was it
what type of your boobs?
The lump was found under my boobs. It moves sometimes. Sometimes it looks as if it beeps. And so I think around that place. I think they said they bring out. I don't know if there's particle of the lumps or thereabout. That's what they say. Yeah, they took for the biopsy.
With a machine.
Sorry, is
maybe a pin?
No, it's
medically feasible.
No, it's a long needle.
Maybe that's why
it has a trigger.
Okay,
it's like a minigun.
What's the size of the needle they used for you? If you're going to estimate it.
How do I?
Was it like 2 inches long, 1 inch long? How was the needle?
I was lying down, so not like you're seeing exactly what is happening. And I'm not in the medical term, so I don't want to say the things.
I'm sorry to say this, right?
Go ahead.
I saw that you studied economics, right? Okay, fantastic. Interesting enough, I dropped econs for further months because economics was very, very detailed and very, very. So as someone that studied econs, I would expect you that if you have a life-threatening diagnosis, you should know it in and out. Because when I see patients with chronic medical conditions, they know their condition in and out. Like sometimes they even know new researches that I have not even heard of because they are trying to survive. I find it very strange that you are mixing radiologists, oncologists. I feel like it's something you should know.
No, it's not something I should know because cancer is not something I am aware about. I've said it
no,
over
but
and
you've
over
been
again.
given this. It's been 2 weeks since you came out to talk about this, and you mentioned stage 4. That was the first video I ever saw from you.
Yes, that was
stage 4. How did they come about that stage 4?
I'm not supposed to know. So maybe at this point
is
we're going
your
to
life.
That's what I'm trying to say. At this point we're going to be asking the medical doctor. So when this whole shenanigans came out on social media, everybody just say let's get a second and a third option.
Okay, so let
How
me
did
say
you know it was
something.
stage 4?
Exactly, how did you know it was
How did
stage?
you
Because
get
he
to the
seems
stage 4
quite confident
analysis?
with that stage 4.
Because that was what I was told. I'm not a medical
How is it
doctor.
possible to say you have stage 4?
Maybe
If
Was
they
it
have-
same that it was that same Enugu doctor?
Yes.
Is it on your report?
Exactly.
She's willing to show the doctor.
I will share.
Yes,
I will share.
I don't.
Okay,
I'm
can you show
interested
that?
I
to
will
see.
share.
So this is your stage 4 report. Is it the doctor that told you that it was stage 4?
Yes, the doctor
By the time
said
you went there
stage
the
4.
second time?
Yes.
But what,
Just
can I-
based on seeing you was when you calculated that it was stage 4?
I do not know them. I don't want to say
what
things
do you
that-
understand? Because if someone tells me something, right, I would go and read up on it. Right. So what did you understand by stage 4? Because I'm assuming that you don't want to die, right? So if someone tells you stage 4, it sounds advanced, right? Or you don't know that.
Yeah, that's the reason why I broke out on social media.
Social media,
Yeah,
to
but how did it
answer the
get to
question
stage
for
4?
you, what was social media? What was your goal on social media?
Now, as a medical practitioner, when they tell you have cancer, it's already traumatic enough.
Okay.
I didn't even have the guts to go and start reading. In fact, the major reason I came on social media was I wanted to see people who have experienced the same thing.
Yeah, but the big question is how did you conclude that it was stage 4?
Stage 4,
Did the doctor
exactly.
just look at you and say, oh, this is stage 4?
She's willing to share the report.
That's
Yes.
what I
Why
was
not allow
told.
the doctor to look at it?
That was
Okay,
what
the
I
doctor
was
can look
told.
at
Yes, I'm very interested.
Can she look at it?
That's what I was
And let me
told.
ask you, as a lawyer, if someone publicly claims... sorry?
It's interesting that you're bringing system results to me because Dr. Odigwe, the pathologist that signed this report, because of course we have
Is it the same report as the one that we saw?
Yes, the
last time?
pathologist that signed this result lives in Asaba. And I'm a doctor, of course. I can trace any doctor in Nigeria. And I called him on Tuesday.
Sorry,
and he
before you
knows
talk,
nothing
is that the
about-
same report
Yes,
that
it's the
you saw
same
last
result.
week?
It's the same result that is going
Okay,
around
that he
social
said he
media.
didn't post, put it around.
And this particular pathologist said he knows nothing about this. And he's based in Asaba, not
The
Enugu.
pathologist of the report?
Yes,
Yeah.
of this report is based in Asaba. I know that for an absolute fact.
So he told you
that's the
after?
first
Yes, because, yes.
He told you that he has nothing to do with it?
Yes, and he stays in Asaba. The address here is Enugu. He hasn't been to Enugu in recent times. He lives in Asaba.
So
Delta
how do you
State.
respond to that?
This
Let's go
pathologist
ahead and-
stays
like
in
I
Because he's saying that
Asaba.
the pathologist that you put in that report, which you claim
That
is your
signed
real
this
report.
report stays in Asaba. That I know for an absolute fact.
Please, I want
on
to ask
Tuesday.
again.
Go ahead.
Is this report the same report that we saw last week?
Yes, it is. It's
So
the
this
same
same
one.
report that we saw last week, that Blessing you claim you didn't post on your Instagram page and on your social media page, is the same report that guy,
Yes,
the guy that
exactly.
we saw on the video, which unfortunately they have not been able to show us, is the same report he printed. So
Absolutely.
this is your real report.
So that's the
What
first one.
happened to the brother of the girl who claims that this report was forged?
I don't know who the person is.
So it's not a fake report.
No, it's not a fake
But the brother of the girl that you just saw just now says this report is his sister's report.
It's not.
And this doctor stays in
So are you
Asaba.
saying, and number one, you're saying you don't know that man. Number two, you're also saying you didn't post this report
I didn't.
to the guy who just spoke on social media.
Absolutely.
But for some coincidence or some funny reason, the reports tally. The report the guy posted and the
Perfectly.
reports here, they are totally the same. Word for word. You are
Even
now
this
saying
doesn't tell us that it's stage 4.
But you are not even saying the oncologist whose name is
No,
there.
the pathologist.
The pathologist whose name is there said he doesn't
lives in
know
Asaba
her.
and he doesn't know anything about this.
So, Blessing, what do you want to say about
Diagnosed
that?
cancer?
No, so the way it works is that, you know, in medicine, there are different fields, right? So the process for a person that comes with a breast lump, you don't know what it is. So the first stage is to go for imaging. You come back from imaging. Right now, the modality is to do a biopsy, fine needle aspiration biopsy. Even if it comes out benign, you have to take out the lump. You
So that
cannot
was-
go because you cannot
should
be
have
very
been taken
sure.
out from the
You
one.
know, yes, because
regardless of
that
whether
is
she wanted it or not.
That is
it
the
is not your
carelessness.
choice unless you discharge yourself against or you do it against medical advice. It's not likely. You cannot come to me and you said you're not ready unless you're not medically fit. Maybe you're very sick, you're pregnant, you're not medically fit. But it's a if they're thinking it's benign, it's a simple surgery. It's not invasive.
Okay.
It's a day surgery. Some people go home that same day. They do go home that same day.
No, but you see, right now it is they are conflicting. There's already inconsistency.
BlessingCeo actually has stage 4 cancer. I know about it. You know, the interviews where she dey grant now, she dey go contradict herself because of the pressure. You know, when you are under pressure, you will not know exactly what to say. You will not start forgetting things. You know, this is my friend, and I know everything about the stage 4 cancer. When she went for that test, yeah, the doctor asked the doctor tell no say na stage 4. Before the doctors now they thought say na lie, say the process wey she thought say they do not be no. The doctor did stage 4. I was there. Doctor collect her body, suck am. You understand? That is stage 4. First one, second one, that is stage 2. Stage 3, stage 4, that is stage 4. That was what the doctor did. And at that time, now what make Blessing know say she get cancer stage 4. So please let's contribute money for her, you know, so that you will cut. Now stage 4, this thing, if you're at stage 1 now, they will cut the bobby like this. They will cut out the bobby if it is stage 1. But stage 4 is very stage 4 bad. They will not cut out the bobby. They will cut here like this. This place. They will cut here. They will cut here to come out. Cut this side of the bobby. Cut the up here. Now come out. Come carry this head. Join the belly. That is the stage 4 cancer. Very dangerous this thing. So that is what they will do for BlessingCeo. Please let's contribute money now, cause make it no come be say the thing don't go from here reach here. They come carry head, put for belly, you understand? Cause when they no go cut out this place through. Yeah. So students, are you ready for this lecture? My name is Uncle Baba. I am your uncle.